we're going to talk about hip flexor tightness. This is one of the most common problems that I see among recreational triathletes, and it really is going to shortchange their performance. So when the hip flexors get tight, they're essentially going to cause your pelvis to tilt in a forward position. Okay? And this essentially is resulting in an arching in the low back, or overextension in the low back. And this is going to cause problems across all three disciplines. So what I want to talk about first is how you assess for hip flexor tightness, and then I'll do a follow-up video to talk about how you go about stretching this particular muscle group. So when it comes to screening for hip flexor tightness, I advocate using the Thomas test, and I'm going to demonstrate that right now. So when you go to perform this test, you have the subject sit at the very edge of the table here, and what you're going to do is slowly roll back and draw both knees up to your chest. All right? We're going to test the right side in this particular case, so I'm going to keep the left knee anchored towards the chest to lock out my low back, and then I'm going to slowly let this thigh fall down towards the floor. Okay? A positive test occurs when the thigh is above parallel. A normal test is when it's parallel to the table, and a negative test, or a loose hip flexor muscle group, occurs whenever the thigh is beyond parallel. Okay? So in my case, I have decent extensibility of my hip flexors, but say if the test presented as such, right, that would indicate the need for a stretching regimen, and that's something that I'm going to show you in the next video. So again, take the time to screen yourself for hip flexor tightness, and if you find that it is positive, that's an indication to get after a stretching program.